and I have an esteemed panelist with me tonight. Camille Masten is actually Jesse Brown VA's Facility Technical Telehealth Coordinator,
Yes.
telehealth services for veterans and those people who are interacting with the VA medical system at Jesse Brown. Today, we're going to talk about what is the telehealth service system and how does the Jesse Brown VA telehealth services operate. So, very, very well to have you here, Camille. I'm so
Thank you.
uh, but you do wonderful work over there, and I know I've benefited from you already, even if I am as one of those digital checkpoints out there.
Yes.
But, tell me about the telehealth service.
So, yes, telehealth is also known as telemedicine. So, we use telecommunications, technology, equipment to support our veterans in their long distance healthcare. And so, our goal is to see our patients at the right, with the right care at the right time at the right place. And how that works is that we pretty much supply our veterans with everything they need so that interaction can be successful. This could include clinical visits, education, or even administration types of encounters. Telehealth pretty much touches almost every service in Jesse Brown right now. And that is
Mhm,
all
mhm,
thanks to COVID and 19 and 2020. When the pandemic hit, we really had to make sure that our providers were connecting with their veterans. But to give you a little bit of background, telehealth at Jesse Brown started and pretty much launched in 2012, even though we had some telehealth going on early 2003 with home telehealth, 2005 with some teledermatology. But in 2012, we really kind of spearheaded getting telehealth into all of our CBOC locations, which are our smaller clinical out-based clinical settings, and also within Jesse Brown. But as you could imagine, during that time, it wasn't very well received because it was new, and we're asking providers to see their doctors patients on the screen as opposed to face to face. So we did have some difficulty getting that process started, but in 2017 we did launch the VCM, the virtual care management manager app. And that app allows our veterans to meet with their providers anywhere they are, vacation, home, wherever they are. They can sit in a video conference and have a visit with their provider. So that was a real game changer. And so, as again 2020 approached, no one knew what was going to happen, that it would happen. And so, with that embarking upon us, we were ready to roll with getting our veterans connected and getting them the health care. We were able to continue the health care that they so much needed. So, telehealth is a great service at Jesse Brown, and I'm just here to spread the word to let everyone know that it is available, and we're here to help our veterans
mhm.
get that care.
It's really interesting what you were saying because I
Yeah.
was thinking as you were talking about how the military and the Department of Defense has always been a leader in technology.
Hmm.
Whether it's our wartime efforts, with munitions, with machines, machinery, with tanks, submarines, and to move into the telehealth realm takes vision and it takes a lot of backing. So we have to really thank just Jesse Brown VA for taking on that responsibility
Yes.
and for the government to have the vision and the foresight because you're talking about 10 years before COVID came.
Yes.
You were already on on the
We were
track
launching. Yes, that's very
launching.
true. Yes. I mean, we were like I would say lawyers chasing after veterans, chasing after doctors to get the business. But once we got everybody on board to realize the significance of it, how important it was that we have these types of ways to see veterans. It didn't take long before everyone was asking. Right now, we have grown tremendously in telehealth. We are able to see patients not only at Jesse Brown but across the visit, which may span over 2 to 3 states within our vision. And we're able to provide care where providers are not able to reach them, maybe face to face or touch them, but we can at least provide the care and close those gaps for our veterans. So, yes.
That's fantastic. And how does that play out as far as family services? Because you sometimes have families that are receiving care. The spouses of veterans.
Yes, so all of the benefits that a spouse that qualifies for can participate in these services. What comes to mind right away is like mental health services,
Mhm.
any type of counseling that a spouse or a family member might qualify for. Definitely, telehealth touches all of those modalities, ways to see a patient, because a lot of times what we're really trying to cut down is the stress of coming into a hospital or driving through traffic or maybe needing a babysitter or not being able to make the time, or even our new veterans who are just coming and getting coming home, who might need to work a job but can't come during an 8 o'clock or 9 o'clock visit, but they can make another visit on lunch break or maybe at some time at home. So yeah, family members are welcome, as long as, and they can also attend the visits with their veterans if they're given permission. For most of our video conferences, they can add up to 5 people into that call, as long as that family member can receive a link and log on, like we're talking right now. They can be a part of that session. So we're very family oriented. We want family involved, and we welcome that.
That's fantastic. Because as you were speaking, I was thinking about also because I'm a physician myself, but I always felt like sometimes patients are feel disconnected because they come in,
Mm.
they sit there for an hour, see you for 5 minutes, and they're gone.
Mhm.
And as being a patient myself, I got to the point where I said, it's really strange. I leave this system and I don't really feel connected to it.
Yeah.
But by being part of the telehealth, it makes you participatory in the process.
Yes, you're
It's
very much a part of that process
right,
as
right.
a veteran. When you come to a video conference, you're going
Mm.
to be greeted by a telepresenter. This is someone who's going to stay in that call during that call with the patient, and
Mhm.
then they are going to see that provider on the screen. They'll be able to talk to them in live time, ask questions. We're going to do lung sounds, heart sounds. We're going to look in the mouth and the
You
ear,
could do
just like
this in a telehealth?
we can do all of this in a telehealth visit. Yes. And it's real time. So
Wow.
it's not anything we're saving. The veteran gets a full visit. It's just like you're there. And we do get some of the vets who are kind of skeptical of coming in, but I've
Mhm.
never met one that when they left, they said, "Wow, this was just like being in a real visit." They felt very comfortable in it, and they also felt supported, because we always have staff in there to help navigate through that whole entire session. But yeah, we can do so many things in telehealth. We have a lot of clinics that we cover in those type of settings.
Oh, okay. So I guess you have to really talk to different specialties too when you're
Yes.
doing the telehealth and making sure things are coordinated correctly.
Yes.
So I mean, it's more than just talking to somebody. It's really coordination as well. You have to sort of bring the pieces together to
Yes.
make sure that the person is getting all the services they require for what they're coming to you for. So
That
how,
is
how does that go?
Well, that's part of my job. So my job is to make sure, along with my staff, Alicia Lindsay and Tambry Seals, also Cheryl Poe Bolinati, we work very close together. Emerson, also our technology manager. I have a staff of about 5 people who help me to coordinate equipment, to coordinate building clinics, staff. Making sure we have proper staffing, as well as the part that I'm most involved in is just the meetings, making sure that we're talking to the chiefs of staffs of these specialty clinics, making sure we're meeting all the needs on both ends, the patient and the provider, and making sure there is a happy medium between everyone's comfort level so that we can get started. So that type of background work, it is a lot that goes on, but we do so many of them. We've gotten through them, and really the providers are at this, I would say right now, are really on board with having these type of visits. So we don't have hardly any pushback. It's just making sure all the pieces come together. It's just making sure that we have everything in place, so that when we're ready to go live and see a patient and start that clinic, everything is ready to go.
That's fantastic, really. And sometimes now it's becoming more and more common that before you come in, you can go online and uh, sort of fill out your medical history
Yes. Hmm.
and do that so that it actually expedites your appointment. So when you
Hmm.
go in, They don't have to go ask sit you there for an hour trying to figure out how to fill this form out.
Yes.
So that's part of the process too, I imagine.
Yeah, it is part of the process, the check-in process. The VA has really come a
Mhm.
long ways with streamlining the process for checking in, for seeing a provider, for seeing any specialty care that they might see. We're always looking for ways to make that process easier. So technology is always changing. There's always something new coming around the corner, and I have to also tip my head to the VA. We are do a very good job keeping abreast of things, making sure we have the best equipment, the best folks
Mhm.
in place to keep things going and running. So it does take a team, but we all work very well together to keep the technology pushing forward and keeping things moving. So yes.
Yeah, I'm really impressed with that, because I started practicing medicine back in the cave days, and we used to walk around and we say a chip. That's just a chip off a rock. What are you talking about, chip? We didn't know about microchips and
Okay.
transmitting information over,
Right.
long distances.
Yeah.
So it looks like the technology is sort of advancing too now with all this AI. So really
Oh
exciting
yeah.
possibilities for the future.
Yes.
And being part of this already, from
Mhm.
2012, you're already on a platform that is, really ready and to embrace the future.
Yes, we are, and it's honestly a tremendous thing to see before your eyes. There's so many things, even now, coming down the pipeline for Jesse Brown. Some tremendous plans for Jesse Brown. Just with clinics, we're getting ready to roll out a audiology hearing test where the patient can sit and have a hearing test at any one of our CBOCs without even having to go into the audiology clinic, and they could be
Mm.
diagnosed,
Wow.
have prescriptions filled, hearing aids, the whole 9 yard. They can even be measured for hearing aids. So the equipment that we work with, very expensive, but very, just can do so many things to keep the streamline that process, making the healthcare so easy for our veterans and accessible. Is what I like to say to them at their fingertips even. So.
Yeah, for veterans who don't know about the system and have been sitting at home wondering, how do I get my care? How do they learn about how to get online, how to sign up for it? Is there a place they should go or a telephone number they need to reach out to?
Well, I would say, telehealth is everywhere right now,
Yeah.
thanks to COVID. So, just your primary care visit, once a veteran decides they are going to register and enroll into VA services as their benefit, not a healthcare, but their benefit, they can automatically be enrolled in telehealth. All they have to do is know that that is always an option. So, I'm here to get the word out to let you know. All you have to do is ask. There's typically always a video conference option. You can come and see your provider face to face, but if you want a video conference, you definitely can have that. Just ask when you're checking in or checking out of those visits. Say, hey, is there an option for a video conference? And if you're interested in that, they your clerks can point you in the right direction. We also offer for some of our veterans who don't have smart devices at home. We have a digital divide program through our national connected care services that will mail a veteran an iPad, and they can
Wow.
use it up to 6 months as long as they have an active telehealth appointment, which is what they'll be using it for
Right.
on their schedule. They will have it for a 6 month period, and it can be renewed as often as it needs to be, and that is free. And we make it very easy. We do the troubleshooting. We'll give them a test call to make sure all equipment is working, and we also, if they ever need some help, at any time of the day, we have a 1-800 number that is, I believe, is 24 hours that they can call for that type of help. So we've tried to cover all the bases to make this a very easy and accessible type of way to receive care for our veterans.
Oh, great. Because I signed up for the telehealth before, and I was speaking to one of the nurses,
Mhm.
and he said, we have this telehealth thing. I said, tele what? And he said, he said, where have you been? So he started laughing. So
Yeah.
he got me signed up for it, and I felt great.
Yes.
I can go online and use my, password, my health,
Yes, for my healthy vet,
Have
yeah,
healthy vet,
yeah, all of
and
that is connected, yes, my
yes,
healthy
yeah.
vet, mhm,
Yeah, it's fantastic.
yes,
So, what would you like to see, in the future? Do you think, the adaptability, because you have younger veterans coming on board now too, a lot from
yes,
OEF, OIF,
yes.
and more recent deployments and more, some active duty who are still around. Um,
I would say for Jesse Brown,
mhm,
although we've received a lot of national funding, we do still need more. And I would
yes.
like to see
Hmm.
more funding for staffing. I'd like
Hmm.
to see telehealth service expand with just the amount of hands that we need to get work done. Right now, I have a staff of like 12, 13, including myself. So
Hmm.
between the 12 of us, we manage 4 C-Box and the entire Jesse Brown,
Wow.
so it is a
Wow.
lot, if
That's a
any
lot.
yeah, one person gets sick, we're kinda like, scrambling, but,
Yeah.
I would like to see more, funding for staffing, and then in that case, we could also expand even more services, throughout
Mhm.
Chicagoland, and make, things more available to our veterans, but the funding and the expansion of telehealth as far as staffing is my number one goal.
Mhm.
I am currently working on that now to see what we can do, to make that happen, but telehealth is going to be, like I told my staff, and I've just been in this position since about a year, coming in September, and I just tell them, I say, telehealth is going to be a different way for medicine that people are even now, even though we have so many clinics, they're still not even thinking of. And so we have to be in front of it, and we can do it. And so with the funding and more hands on deck, I know we can push this even further into Jesse Brown to make it just the overall, part of the backbone, I would say, maybe not the entire, but part of that backbone of Jesse Brown and healthcare services for our veterans. So
Well, Camille, I had to commend you because
thank you.
they had the right person in the right place.
Oh,
I mean,
thank you.
your enthusiasm and that this is phenomenal. I really love it when I see someone who's dedicated
Thank
and
you.
doing things for the veterans. Because my background, I did a lot of public health,
Mhm.
and I ran the state health department for Illinois from 2007 to 11. But with public health, I always say this: we underestimate the impact of what people are doing.
Yes.
And the reason is that if you were on the Dan Ryan coming into Chicago and you had a major car accident, a truck
Mm,
accident, and if you took away the police, the tow trucks, all those the services that come to clear up the accident, people would be stuck there. You would have billions of dollars of damage done because bankers can't get downtown to work.
yes.
Medical doctors and nurses can't get to work.
Mhm.
Lawyers can't get to work. No one is going to go anywhere. And they're sitting there for hours and hours trying to figure out what do we do with this.
Yes.
So the money we spend on those services to clear up the highway is essential to keep us healthy. So I was thinking about that in the same light as telehealth. Now, when you're talking to veterans, you may catch them at the early stages of disease
Mhm.
where it doesn't progress. You stop a stroke, you stop a heart
Yes.
attack, that can have profound implications for savings for the government. So we have to really think about, where we're putting our money and putting more money into something like you were saying to
Yes.
prevent things from getting worse.
Yes. I agree. I
Yeah.
agree. Right now, we are
Mhm.
seeing over
Mhm.
70,000 patients to date, over
Mm.
close to 80,000. And we've increased telehealth
Wow,
23% from last year.
that's a
So
day.
we are definitely, well,
Did you
up to this, no, not in a day, but up to this date.
up to
So
the state? Okay.
yeah, yeah. So this FY fiscal year 24, we've seen over 80,000
Eighty
patients.
thousand.
Yeah, so that
Wow.
includes over 20,000 women veterans, and the other remaining 50 to 60,000 would be our men veterans. So we're seeing a lot of patients
Wow.
that way, and it's not
Wow.
going to go away. So it's just going to get bigger. We've increased our reach to veterans by 23% from last year. So we are making some real strides. And so it's coming, and I know it will come, and we're ready for it. So
Yeah.
yeah.
And I'm glad you're doing that, and I know the families are really appreciative too. That
Mhm.
where that they have it impacts them too. If someone is sick at home and they can't find health care, that someone has to stay at home. And I had a veteran that sticks in my mind all the time. He was a farmer, and he was down in Southern Illinois, and he lost both of his legs and his right arm in
Mm,
the war. And he was down there. His wife was working three jobs trying to keep everything afloat because he couldn't farm, and he was isolated. And I was like, my goodness, what can be done for someone like that?
yeah,
And those kinds of services, making sure they're linked into the system with telehealth, those people who have disabilities and those kinds of things. It's not, for me, it's hard enough getting around at my age,
yes,
trying to get my back straightened out.
yeah,
but, but, can imagine, with a disability trying
yes,
to navigate a system that's that difficult. It's heartbreaking. So I'm so glad that you are part of a service that is trying to address that issue for our veterans and their families.
yes, yes.
Yeah.
Thank you so much, and that is our goal,
Mhm.
every day that we come in, that we are meeting that, each and every day. So thank you so much for saying that.
Oh, okay. Yeah. So, anything else that you want to share with us about the program over there? Again,
Um,
how to contact them and that kind of thing. Because I like to say that a couple of times in the show because people,
yes.
start to write things down or try to, figure out how to get there.
Yes, if you're a veteran that's looking for health care through the VA, you're not, first thing you want to do is make sure you're registered and enrolled. When you have your first visit with your primary care, you can start any type of telehealth at that time. We're at almost every service that I can think of. We have primary care, we have geriatrics, we have genomics, we have sleep clinics, we have cardiology, bariatrics, even weight loss. We just launched a couple weight loss clinics at our CBOX.
Mm,
Very
mm,
popular topic these days. And
mm,
we follow diabetic patients, nutrition, um, caregiver programs, almost everything,
mm.
women's health, anything you could think of that is offered here, there will be some type of telehealth modality associated with that for the veterans' convenience. So, they don't have to come out. They can have their follow ups, they can have their visits in the comfort of their home. If they don't have a smart device, we can supply that for them through the digital divide. Again, that would go through your primary care and social work, and they will make sure that those devices are sent out to the veterans on a 6-month rotation.
Wow.
And so, yeah, we're here to help you. All you have to do is ask. Once you're enrolled and registered, you can just ask about these types of visits. It's almost in every service.
Mm.
So we have so many services that I can't think of really too many that we have in touch. Even for exercise and move, there's some type of video or a telehealth option for that. So
Yeah. And
it's everywhere.
why don't you explain to people what the CBOT is too? Some people may not be familiar
Oh,
with it,
sure. Yes.
terminology.
So the clinical community-based outpatient clinics are our small satellite clinics that are in the Chicagoland area. So Jesse Brown, I'm not from Chicago, but I'll do my best. Jesse Brown is kind of like on the west side of, like the near west side off of downtown in the medical district, right? So we have Lakeside, which is located in the downtown area, I believe off of Ontario Street, if don't, or high, one of those streets there,
Yes,
but
yes,
right in the downtown area. Then we have Auburn Gresham, located affectionately in the Auburn Gresham neighborhood.
yes, yes.
Then we
I
have
know that.
Chicago Heights, also located in Chicago Heights. Um, the city of Chicago Heights. And then the last but not least is Crown Point, which is located in Crown Point, Indiana, the
Indiana.
Adam Benjamin
Yes.
Clinic. So the further out the smaller CBOC clinics are, the more telehealth services you're probably going to have there because they're so
Mhm.
far out. So yeah, you'll. ABJ does tend to have the majority of our telehealth clinics, but we are building them just as many at our other locations. We don't want anybody to feel left out. So, um, the only
Right.
challenge we have there is probably spacing. These are smaller
Mhm.
clinics. But yeah, they're located in these areas so that you don't have to travel all the
Great.
time to Jesse Brown.